You slept 8 hours last night, and you are still exhausted. You have had 3 cups of coffee before noon. You canceled plans because you just did not have the energy. You have Googled, "Why am I so tired all the time?" more times than you can count, and every result told you to sleep more, stress less, eat better. But you are already doing all of that. So what is actually going on? Today, we are going to answer that question with real science, current research, and the clarity. Because chronic fatigue is one of the most commonly dismissed symptoms in medicine. And in the majority of cases, there is a specific, identifiable, and treatable cause. Sometimes more than one. In this video, we will cover the 4 most common medical drivers of fatigue in women: iron deficiency anemia, hypothyroidism, irritable bowel syndrome, and a 4th, because that is quietly affecting millions. For each one, we will explain exactly what is happening in your body, what the latest research shows, and what you can do about it. Every statistic you hear is sourced from peer-reviewed publications or official health bodies. References are listed at the end. Before we get into causes, let us understand the scope of what we are dealing with. Fatigue is the single most common complaint brought to primary care physicians worldwide. It is not a disease itself. It is a signal that something inside the body is not working the way it should. And in women, that signal is dramatically more common than in men, across almost every underlying cause. A 2024 data brief from the CDC's National Health and Nutrition Examination survey found that the prevalence of anemia, one of the top causes of fatigue, was 13% in females overall, compared to just 5.5% in males. Among adolescent girls, aged 12 to 19, that figure jumped to 17.4%. A landmark 2025 review published in JAMA, one of the most respected medical journals in the world, found that absolute iron deficiency affects approximately 2 billion people globally, and in high-income countries, approximately 38% of non-pregnant women of reproductive age have iron deficiency without anemia. That means their iron is low enough to cause symptoms, including fatigue, even before their blood count falls below the clinical threshold. And iron deficiency is just one cause. When you add in thyroid disorders, which affect up to 10% of women, and irritable bowel syndrome, which a 2025 meta-analysis found affects 14.1% of people globally, with women up to twice as likely to be affected as men, we are looking at overlapping conditions that are quietly draining the energy of millions of women every single day. The question is not whether one of these might be affecting you. The question is, which one? Cause. Number 1. Iron deficiency anemia. Iron deficiency anemia is the leading cause of fatigue in women globally, and it is still being missed. Here is why it happens. Iron is the essential component of hemoglobin, the protein in your red blood cells that carries oxygen from your lungs to every cell in your body. When your iron stores are low, your cells do not get enough oxygen. And when your cells do not get enough oxygen, your body slows down, starting with your energy. The most important thing to understand is that you do not have to be clinically anemic to feel the effects. The JAMA 2025 review confirmed that iron deficiency without anemia, called non-anemic iron deficiency, NAID, is independently associated with fatigue, reduced work performance, and reduced cognitive function. This means your blood count can come back normal, and your doctor can tell you everything looks fine, while your iron stores are low, enough to be causing significant daily fatigue. Who is most at risk? Women of reproductive age. Heavy menstrual bleeding is the leading cause of iron deficiency in this group. Pregnant women. Iron deficiency affects up to 84% of women in the 3rd trimester in high-income countries. Women with inflammatory bowel disease, celiac disease, or who have had bariatric surgery, all of which impair iron absorption. Women with low dietary iron intake, including those following plant-based diets, without adequate supplementation. What are the symptoms beyond fatigue? Headaches. One of the most overlooked signs of iron deficiency. hair loss, and brittle nails. Iron is essential for follicle health. Restless leg syndrome, occurring in 32 to 40% of iron-deficient individuals. Difficulty concentrating, irritability, and low mood. Shortness of breath, on exertion, rapid heartbeat, pale skin. Pica, craving non-food items, like ice, clay, or starch. Found in 40 to 50% of those with iron deficiency. How is it diagnosed and treated? Diagnosis requires a blood test, specifically serum ferritin, which reflects your iron stores. A standard complete blood count alone is not enough. In 2024, the lower limit of normal for ferritin was raised in major Canadian clinical laboratories to better reflect the evidence that symptoms begin before ferritin falls to historically low thresholds. Treatment: oral iron supplementation, most commonly ferrous sulfate, is first-line therapy for most women. Intravenous iron is indicated when oral iron is not tolerated or absorption is impaired. Identifying and addressing the underlying cause of blood loss is equally essential. Cause number 2: hypothyroidism. Your thyroid gland sits at the front of your neck. It is small, and it controls almost everything. Hypothyroidism, an underactive thyroid, means your thyroid is not producing enough thyroid hormone. And because thyroid hormone regulates your metabolism, your brain function, your heart rate, and your body temperature. When it falls short, your entire system slows down. The result is a profound, persistent fatigue that sleep does not fix. A review published in the Lancet in 2024 confirmed that hypothyroidism affects up to 5% of the general population, with a further estimated 5% undiagnosed, meaning up to 1 in 10 people may have thyroid dysfunction they are not aware of. Women are significantly more affected than men at every age. The most common cause in developed countries is Hashimoto's thyroiditis, an autoimmune disease in which the immune system attacks and gradually destroys the thyroid gland. The Office on Women's Health notes that women are far more susceptible to autoimmune thyroid disease than men, and that symptoms often go unrecognized for years because they are nonspecific and overlap with stress, aging, and depression. Key symptoms of hypothyroidism: persistent fatigue and lethargy. 1/3 of hypothyroid patients present with fatigue as a primary complaint. Weight gain and difficulty losing weight. Hair loss, experienced by 33% of hypothyroid patients. Depression, to 40% of hypothyroid patients develop clinically significant depression. REF9. Memory problems, brain fog, difficulty concentrating. Cold intolerance, dry skin, constipation. Irregular or heavy periods. An important clinical note. A 2025 UK survey published in the European Thyroid Journal found that even among patients already diagnosed and taking thyroid hormone replacement levothyroxine, a substantial proportion continued to experience significant fatigue. This matters because it means a normal TSH test result does not always mean your fatigue is resolved. If you are on thyroid medication and still exhausted, the research supports reevaluating your dosage or exploring combination therapy. Diagnosis: a blood test measuring thyroid-stimulating hormone, TSH, and free T4 is the standard first step. Treatment is typically lifelong thyroid hormone replacement with levothyroxine, adjusted to symptom response and not just TSH normalization. Cause number 3: irritable bowel syndrome. This one surprises people. You might think of IBS as a stomach problem, not an energy problem. But the research tells a very different story. A 2025 meta-analysis reviewing 96 studies across 52 countries found the global prevalence of IBS at 14.1%, with women up to twice as likely to be affected as men. The condition is characterized by abdominal pain, bloating, and changes in bowel habits. But fatigue is one of its most common and most overlooked features. Why does IBS cause fatigue? Several mechanisms are at work simultaneously. The gut-brain axis. IBS involves bidirectional disruption between the brain and the gut. Chronic gut inflammation and visceral pain signal the nervous system continuously, which is physically and neurologically exhausting. Sleep disruption, abdominal discomfort, and urgency disturb sleep quality, contributing directly to daytime fatigue. Nutritional consequences. Fear of food, dietary restriction, and malabsorption can reduce intake of iron and B vitamins, further compounding fatigue. Shared pathology with chronic fatigue syndrome. Research from Columbia University found that up to 90% of myalgic encephalomyelitis and chronic fatigue syndrome patients also have IBS. A large national inpatient study found IBS patients had 5.4 times higher odds of also having chronic fatigue syndrome. The connection between IBS and fatigue is not coincidental, it is biological. The gut microbiome, the community of bacteria living in your intestines, directly influences energy production, immune function, and even mood. Through the gut-brain axis, when the microbiome is disrupted, as it often is in IBS, the downstream effects include fatigue, cognitive difficulties, and mood disturbance. Management of IBS-related fatigue. Probiotics emerging evidence supports specific strains for gut microbiome restoration. Cognitive behavioral therapy, CBT, has demonstrated effectiveness for IBS and associated fatigue. Poor food absorption in the gut. Treating the fatigue directly. Addressing iron and vitamin deficiencies that coexist with IBS. Number 3. Irritable bowel, SYND. ROM, this one surprises people. You might think of IBS as a stomach problem, not an energy problem. But the research tells a very different story. A 2025 meta-analysis reviewing 96 studies across 52 countries found the global prevalence of IBS at 14.1%, with women up to twice as likely to be affected as men. The condition is characterized by abdominal pain, bloating, and changes in bowel habits. But fatigue is one of its most common and most overlooked features. Why does IBS cause fatigue? Several mechanisms are at work simultaneously. The gut-brain axis. IBS involves bidirectional disruption between the brain and the gut. Chronic gut inflammation and visceral pain signal the nervous system continuously, which is physically and neurologically exhausting. Sleep disruption, abdominal discomfort, and urgency disturb sleep quality, contributing directly to daytime fatigue. Nutritional consequences. Fear of food, dietary restriction, and malabsorption can reduce intake of iron and B vitamins, further compounding fatigue. Shared pathology with chronic fatigue syndrome. Research from Columbia University found that up to 90% of myalgic encephalomyelitis, ME, and chronic fatigue syndrome, CFS, patients also have irritable bowel syndrome. A large national inpatient study found IBS patients had 5.4 times higher odds of also having chronic fatigue syndrome. The connection between IBS and fatigue is not coincidental, it is biological. The gut microbiome, the community of bacteria living in your intestines, directly influences energy production, immune function, and even mood. Through the gut-brain axis, when the microbiome is disrupted, as it often is in IBS, the downstream effects include fatigue, cognitive difficulties, and mood disturbance. Management of IBS-related fatigue. Low FODMAP diet. A dietary approach with strong clinical evidence for reducing IBS symptoms. Probiotics emerging evidence supports specific strains for gut microbiome restoration. Cognitive behavioral therapy, CBT, has demonstrated effectiveness for IBS and associated fatigue. Treating the fatigue directly. Addressing iron and vitamin deficiencies that coexist with irritable bowel syndrome. Cause number 4. The overlooked driver, chronic inflammation. The fourth driver of chronic fatigue in women is one that often goes unnamed at the doctor's office: Most of the time, even when it is actively measurable. Chronic, low-grade inflammation. Inflammation is your immune system's response to threat. Acute inflammation, like when you sprain an ankle, is short-term and purposeful. But chronic, low-grade systemic inflammation is different. It is the immune system, perpetually switched on, constantly consuming energy, constantly producing inflammatory signaling molecules that cross the blood-brain barrier and cause what researchers call sickness behavior, fatigue, cognitive slowing, low mood, and social withdrawal. What drives chronic inflammation in women? The list is substantial. Hashimoto's, thyroiditis, PCOS, obesity, sleep deprivation, chronic psychological stress, environmental toxin exposure, and a diet high in ultra-processed foods. These conditions feed into each other, and fatigue is a common output of all of them. Research, published in Frontiers in Endocrinology 2025, confirmed that individuals with positive thyroid autoantibodies report higher prevalence of fatigue, cognitive dysfunction, and low mood, even when TSH and T4 levels are normal. The underlying mechanism involves elevated pro-inflammatory cytokines, including interleukin-6 and tumor necrosis factor alpha, which directly impairs cellular energy production. This is why some women feel chronically exhausted despite normal blood tests. The test being ordered may not be measuring what is actually wrong. What can you do? Your doctor may request for a CRP C-reactive protein test, a marker of systemic inflammation, alongside standard blood work. Address modifiable drivers: diet quality, sleep, stress, physical activity, an anti-inflammatory dietary pattern, rich in vegetables, oily fish, legumes, and whole grains, has demonstrated immeasurable reductions in inflammatory markers. Discuss with your physician whether additional autoimmune screening is appropriate based on your full symptom picture. What to do next? If you have watched this far and recognized yourself in more than one of these causes, that is not a coincidence. These conditions frequently co-exist. Iron deficiency worsens IBS. Hypothyroidism amplifies inflammation. IBS disrupts nutrient absorption, which depletes iron. They share mechanisms, and they share a patient. The 5 things your doctor may ask you at your next appointment. 1. A full iron panel, including serum ferritin, not just a standard CBC. 2. TSH and free T4 to screen for thyroid dysfunction. 3. CRP or ESR markers of systemic inflammation. 4. A clinical assessment for IBS. If you have regular bloating, pain, or altered bowel habits. 5. A vitamin B12 and vitamin D level. Both are common deficiencies that contribute independently to fatigue. Do not accept fatigue as your baseline. It is not a personality trait. It is not who you are. It is a signal, and now you have the language to start investigating what that signal means. Closing. Chronic fatigue is not rare. It is not mysterious, and it is not something you should just push through. The research is clear. Iron deficiency, thyroid dysfunction, IBS, and chronic inflammation are 4 of the most common and most undertreated drivers of exhaustion in women, and all 4 are diagnosable, manageable, and in many cases, fully reversible. Share this video with someone who has been told their tiredness is just stress. Subscribe for more evidence-based health content.